Hello, welcome to Jacinta Polley Healthy Living channel. Today we would be talking about diarrhea. What is diarrhea? When you have diarrhea, your bowel movements or stools are loose and watery. It's common and usually not serious. Many people get diarrhea a few times a year. It normally lasts 2 to 3 days. Some people get it more often. It could be because they have irritable bowel syndrome (IBS) or other conditions. Diarrhea is one of the most common health complaints. It can range from a mild, temporary condition to a potentially life-threatening one. Globally, an estimated 2 billion cases of the diarrheal disease occur each year. Also, around 1.9 million children under the age of 5 years, mostly in developing countries, die from diarrhea every year. This makes it the second leading cause of death in this age group. Diarrhea is characterized by abnormally loose or watery stools. Most cases of diarrhea are due to bacteria, viruses, or parasites. Digestive system disorders can also cause chronic diarrhea. Diarrhea can happen for a wide variety of reasons, and it usually goes away on its own in 1 to 3 days. When you have diarrhea, you may need to quickly run to the bathroom with urgency, and this may happen more frequently than normal. You may also feel bloated, have lower abdominal cramping, and sometimes experience nausea. Although most cases of diarrhea are self-limited, happening for a fixed amount of time and steady level of severity, sometimes diarrhea can lead to serious complications. Diarrhea can cause dehydration when your body loses large amounts of water, electrolyte imbalance, loss of sodium, potassium, and magnesium that play a key role in vital bodily functions, and kidney failure. Not enough blood fluid is supplied to the kidneys. When you have diarrhea, you lose water and electrolytes along with stool. You need to drink plenty of fluids to replace what's lost. Dehydration can become serious if it fails to resolve, get better, worsens, and is not addressed adequately. If a person frequently passes stools but they are of normal consistency, this is not diarrhea. Similarly, breastfed babies often pass loose, sticky stools. This is normal. Diarrhea is very common, happening in most people a few times each year. When you have diarrhea, your stool will be loose and watery. In most cases, the cause is unknown and it goes away on its own after a few days. Diarrhea can be caused by bacteria. Dehydration is a dangerous side effect of diarrhea. Luckily, diarrhea is usually short-lived, lasting no more than a few days. But, when diarrhea lasts for weeks, it usually indicates that there's another problem. If you have diarrhea for weeks or longer, you may have a condition such as irritable bowel disorder, or a more serious disorder, such as a persistent infection or inflammatory bowel disease. What's the difference between normal diarrhea and severe diarrhea? Who is at risk for diarrhea? People of all ages can get diarrhea. On average, adults in the United States have acute diarrhea once a year. Young children have an average of twice a year. People who visit developing countries are at risk for travelers' diarrhea. It is caused by consuming contaminated food or water. However, diarrhea can be serious in certain groups of people, including young children, older adults, the elderly. Can diarrhea harm your health? In general, diarrhea is self-limited and goes away, resolves without intervention. If your diarrhea fails to improve and resolve completely, you can be at risk of complications, dehydration, electrolyte imbalance, kidney failure, and organ damage. Call your healthcare provider if you have diarrhea that fails to get better or go away, or if you experience symptoms of dehydration. These symptoms can include dark urine and small amounts of urine or loss of urine production, rapid heart rate, headaches, flushed, dry skin, irritability, and confusion, lightheadedness and dizziness, severe nausea and vomiting, the inability to tolerate or keep anything down by mouth. What causes diarrhea? The most common cause of acute diarrhea is infection, viral, bacterial, and parasitic. Bacteria also can cause acute food poisoning. A third important cause of acute diarrhea is starting a new medication, since many medications can cause diarrhea. You may experience diarrhea as a result of a number of conditions or circumstances. Potential causes of diarrhea include a food intolerance, such as lactose intolerance, a food allergy, an adverse reaction to medication, a viral infection, a bacterial infection, an intestinal disease, a parasitic infection, gallbladder or stomach surgery. Rotavirus is a common cause of childhood diarrhea. Bacterial infections due to Salmonella or E. coli, among others, are also common. Acute and persistent diarrhea may have causes that are different from those of chronic diarrhea. In many cases, doctors do not find the cause of diarrhea. Most diarrhea goes away on its own within 4 days, and finding the cause is not necessary. 3 types of infections that cause diarrhea include viral infections. Many viruses cause diarrhea, including norovirus NIH external link and rotavirus NIH external link. Viral gastroenteritis is a common cause of acute diarrhea. Bacterial infections. Several types of bacteria can enter your body through contaminated food or water and cause diarrhea. Common bacteria that cause diarrhea include Campylobacter NIH external link, Escherichia coli NIH external link, E. coli, Salmonella NIH external link, and Shigella NIH external link. Parasitic infections. Parasites can enter your body through food or water and settle in your digestive tract. Parasites that cause diarrhea include Cryptosporidium enteritis NIH external link, Entamoeba histolytica NIH external link, and Giardia lamblia NIH external link. Infections in the digestive tract that spread through foods or drinks are called foodborne illnesses. Infections lasting more than 2 weeks and less than 4 weeks can cause persistent diarrhea. Traveler's diarrhea. Traveler's diarrhea external link is caused by eating food or drinking water contaminated with bacteria, viruses, or parasites. Traveler's diarrhea is most often acute. However, some parasites cause diarrhea that lasts longer. Traveler's diarrhea can be a problem for people traveling to developing countries. Signs and symptoms associated with diarrhea may include loose, watery stools, abdominal cramps, abdominal pain, fever, blood in the stool, mucus in the stool, bloating, nausea, urgent need to have a bowel movement. When to see a doctor. If you're an adult, see your doctor. If your diarrhea persists beyond a few days, you become dehydrated, severe abdominal or rectal pain, bloody or black stools, fever above 102 F 39 C, excessive thirst, dry mouth or skin, little or no urination, weakness, dizziness or lightheadedness, fatigue, dark-colored urine in children, particularly young children, diarrhea can quickly lead to dehydration. Call your doctor if your child's diarrhea doesn't improve within 24 hours, or if your baby becomes dehydrated, has a fever above 102 F 39 C, has bloody or black stools. A number of diseases and conditions can cause diarrhea, including viruses. Viruses that can cause diarrhea include Norwalk virus, cytomegalovirus, and viral hepatitis. Rotavirus is a common cause of acute childhood diarrhea. The virus that causes coronavirus disease 2019 COVID-19 has also been associated with gastrointestinal symptoms, including nausea, vomiting, and diarrhea. Bacteria and parasites. Contaminated food or water can transmit bacteria and parasites to your body. When traveling in developing countries, diarrhea caused by bacteria and parasites is often called traveler's diarrhea. Clostridium difficile is another type of bacteria that can cause serious infections that cause diarrhea, and it can occur after a course of antibiotics or during a hospitalization. Medications. Many medications, such as antibiotics, can cause diarrhea. Antibiotics destroy both good and bad bacteria, which can disturb the natural balance of bacteria in your intestines. Other drugs that cause diarrhea are cancer drugs and antacids with magnesium. Artificial sweeteners. Sorbitol and mannitol, artificial sweeteners found in chewing gum and other sugar-free products, can cause diarrhea in some otherwise healthy people. Surgery. Abdominal or gallbladder removal surgeries can sometimes cause diarrhea. Other digestive disorders. Chronic diarrhea has a number of other causes, such as Crohn's disease, ulcerative colitis, celiac disease, microscopic colitis, and irritable bowel syndrome. Some other major causes of chronic diarrhea include microscopic colitis. This is a persistent type of diarrhea that usually affects older adults. It develops due to inflammation and occurs often during the night. Malabsorptive and maldigestive diarrhea. The first is due to impaired nutrient absorption, and the second is due to impaired digestive function. Celiac disease is one example. Chronic infections. A history of travel or antibiotic use can be clues in chronic diarrhea. Various bacteria and parasites can also be the cause. Drug-induced diarrhea. Laxatives and other drugs, including antibiotics, can trigger diarrhea. Endocrine-related causes. Sometimes, hormonal factors cause diarrhea. This is the case in Addison's disease and carcinoid tumors. Cancer-related causes. Neoplastic diarrhea is associated with a number of gut cancers. Complications. Two potentially serious complications of diarrhea are dehydration in cases of severe and frequent diarrhea, and malabsorption in cases of chronic diarrhea. Diarrhea can also indicate a wide range of underlying chronic conditions. Diagnosis and treatment can help prevent further problems. Diarrhea can cause dehydration, which can be life-threatening if untreated. Dehydration is particularly dangerous in children, older adults, and those with weakened immune systems. If you have signs of serious dehydration, seek medical help. These may include a full blood count, anemia may suggest malnutrition, bleeding ulcerations, or IBD. Liver function tests. These will include testing albumin levels. Tests for malabsorption. These will check the absorption of calcium, vitamin B12, and folate. They will also assess the iron status and thyroid function. Erythrocyte sedimentation rate and C-reactive protein. Raised levels may indicate IBD. Tests for antibodies. These may detect celiac disease. Stool tests. Doctors can identify parasites, bacteria, and a few viruses in stool cultures. Stool tests can also reveal microscopic blood, white blood cells, and other clues for diagnosis. Prevention. The following can help prevent diarrhea: drinking clean and safe water only, having good sanitation systems, such as wastewater and sewage, having good hygiene practices, such as regularly washing the hands with soap, especially before preparing food and eating and after using the bathroom, educating oneself on the spread of infection. There is evidence to suggest that interventions from public health bodies to promote hand washing can reduce diarrhea rates by about 1/3. In developing countries, however, the prevention of diarrhea may be more challenging due to dirty water and poor sanitation. Wash your hands to prevent the spread of viral diarrhea. To ensure adequate hand washing, wash frequently. Wash your hands before and after preparing food. Wash your hands after handling uncooked meat, using the toilet, changing diapers, sneezing, coughing and blowing your nose. Lather with soap for at least 20 seconds. After putting soap on your hands, rub your hands together for at least 20 seconds. This is about as long as it takes to sing "Happy Birthday" twice through. Use hand sanitizer when washing isn't possible. Use an alcohol-based hand sanitizer when you can't get to a sink. Apply the hand sanitizer as you would hand lotion, making sure to cover the fronts and backs of both hands. Use a product that contains at least 60% alcohol. Vaccination. You can help protect your infant from rotavirus, the most common cause of viral diarrhea in children, with one of 2 approved vaccines. Ask your baby's doctor about having your baby vaccinated. Preventing travelers' diarrhea. Diarrhea commonly affects people who travel to countries where there are inadequate sanitation and contaminated food. To reduce your risk, watch what you eat. Eat hot, well-cooked foods. Avoid raw fruits and vegetables unless you can peel them yourself. Also, avoid raw or undercooked meats and dairy foods. Watch what you drink. Drink bottled water, soda, beer, or wine served in its original container. Avoid tap water and ice cubes. Use bottled water even for brushing your teeth. Keep your mouth closed while you shower. Beverages made with boiled water, such as coffee and tea, are probably safe. Remember that alcohol and caffeine can aggravate diarrhea and worsen dehydration. Ask your doctor about antibiotics. If you're traveling to a developing country for an extended time, ask your doctor about antibiotics before you go, especially if you have a weakened immune system. Check for travel warnings. The Centers for Disease Control and Prevention maintains a traveler's health website where disease warnings are posted for various countries. If you're planning to travel outside of the United States, check there for warnings and tips for reducing your risk. Get started and live a life that avoids you from getting in contact with diarrhea. Please don't forget to subscribe to our channel for more recommendations on health, relationship, lifestyle and other helpful information to form life easier.